Say goodbye to the needles and the knife. There is an innovative, non-surgical treatment that will give you that youthful glow of the years gone by, and I want it. Here to tell us about Foto Facial RF are Kristie Bair and Dr. Dean Bair of Bair Medical Spa. Good morning to both of you.
Good morning.
Looking fantastic as always.
Thank you.
The picture of beauty and youth. you are what you are, and I'll tell you what, anybody should come to you guys for whatever they need. I'll tell you what, the Foto Facial RF is a really interesting treatment, and again, non-invasive. Tell us a little bit about it.
Well, Foto Facial RF is a procedure that's been around for many years and has advanced to the point where it's very effective. It is for pigment changes in the skin.
Okay.
We've all experienced being out in the sun, getting freckles that all of a sudden don't look like freckles.
Yes.
So this is to treat that, as well as dilated blood vessels, face, chest, hands, arms.
Yes, so don't be thrown by the name facial, because it doesn't necessarily be confined to your face. You can actually, anywhere that you have that, so that's good to know. Just demystify that right from the start. When you come into the office, as I have for a consultation, and you put your face, what is that machine called where you get to see the pigment?
A skin scanner.
Oh, it's devastating. Let me just say, for those of you, it's shocking when you've been in the sun a lot. So I assume I'm a candidate for this. Tell everybody out there who else would be candidates for this kind of treatment.
Anyone that has pigment changes.
Okay.
Really, quite frankly, anyone over 35
really
has had pigment changes.
And is it mainly because of sun damage?
It's absolutely because of sun damage. I was just visiting my 5-year-old granddaughter in Phoenix this weekend, who's a redhead covered with freckles.
Oh my gosh.
That's sun damage. Freckles. Freckles are always caused by sun.
And when you're a kid and your parents or people say stay out of the sun, you'll regret it when you get older. It's not just a saying, it's not just a cliche, it's the truth. You really do.
We can take care of that now.
But you can fix it. Exactly. There's a solution. So now we know who needs it. Who shouldn't undergo photofacial?
Virtually anyone can have it.
Really?
We treat even African Americans, because they do have skin changes and pigment changes as well.
Sure.
This particular technology is an advance in that it uses not only the light from the crystal, but also radio frequency that drives the heat down into the pigment. It has a chiller on the surface that protects the surface. So we can treat with this particular instrument all skin tones.
So the cooler basically keeps you from burning, I guess,
exactly.
Right? Does it hurt?
I've had numerous treatments with this. No,
really?
It doesn't hurt.
Good.
It feels like a rubber band snapping on your skin. But we put a topical numbing cream on. It's a comfortable procedure.
And that's comforting too, to go to somebody who's actually done it themselves, because you know what to expect and you can help us understand that. Are there side effects?
You're going to be pink the day you have it, like you've been out in the sun.
Okay.
The next day you're going to be fine. 3 to 5 days later, the spots will get darker, but they will appear like little flecks of pepper.
Oh.
Then within a week, literally, you'll get out of the shower one morning and they will be gone. They will have sloughed off. Yes.
So almost like a scab?
Yeah,
they just kind of fall off?
More like a teeny little scale.
Like a little scale, okay.
That's a good way to describe it,
So that's not bad. And
I had my hands treated 4 years ago.
Well, your hands are gorgeous.
And I'll do it again this fall when, I mean, this is a perfect time of year because we're not out in the sun as much.
Well, can you do it on parts of your arm? I mean, I have tons of freckles on my arm and my chest, so you said you can do it kind of anywhere. And you really see those results, not immediately the day up, but within a week. That's fairly close.
Yeah, it's a hugely satisfying treatment because everyone gets results.
I love that. And in fact, speaking of results, let's take a look at some before and after photos and kind of see that in a visual sense, how we can compare. Oh my gosh, whoa, look at her skin.
It is, it's amazing.
It really creates a clear, glowing skin.
I want that. I say that every time, don't I? Oh my gosh. So now, so when she came to you, did she just said to you, this is something I need? I mean, and it doesn't matter what age, right?
Right.
Because this girl looks very young.
You know, everyone, particularly New Mexico, high altitude, over 300 days of sunshine a year, we're going to have pigment changes. And it is primarily from the sun. Also hormonal changes. The mask of pregnancy, melasma, also responds to this treatment.
Wow. And so now you said generally anybody over 35 has probably had some pigment changes, but even if you're under 35, it's still an option, isn't it?
Yes,
okay.
Absolutely.
Well, it's so nice to know that. And so basically downtime-wise, you said you get a little red the day of, but is that it, or is there any other downtime?
No, that's it. This is virtually a no downtime.
So you don't need to take days off of work?
Oh, no.
No, absolutely not.
Good.
Absolutely not.
So we'll do the treatment, then we'll put a little minimal makeup on.
Okay.
People go back to work.
I love to know.
And you know, in New Mexico, the thing is, even if you're careful, even if you're using sunscreen all the time, just being out and living your life.
Oh yeah, I mean, I use the sunscreen that you brought on the show in Kristie's favorite things, and it is amazing. It really is, because you feel like you're wearing your makeup, but you also know that you're protected. But even then, even being protected, like you said, you still are going to be dealing with those kind of changes.
Absolutely.
And if you're considering these treatments, do you need a series of them? How many are generally recommended?
That varies, but typically someone's going to need 3 to 5.
Okay.
Now hands, different parts of the body respond really well. I only had 2 treatments on my hands. And your décolleté may respond differently, but typically 3 to 5.
Typically 3 to 5. And then what about the results? Do they last for an extended period of time?
They're going to last. That pigment, we've drawn that out and it's gone. Now depending on if you spend the whole next summer laying out in the sun, right. It's going to come back. But typically what happens is after a year or 2, people will come in for 1 maintenance treatment.
That's great. That's not bad at all. And you said it doesn't hurt, which is definitely comforting. I love to hear that. You know, it kind of reminds me, we talk so much financially, and I thought, what you just said kind of reminds me of if somebody gets into debt and they finally pay off their bills, yeah, they can be out of debt forever. It's just a matter of their own choices. Right. So it's kind of a very similar analogy. You know, you make those choices. You make the time, you get it done, you clear it out of your skin, you look good, and you want to take care of yourself from that point forward. And I know you guys give great advice and great recommendations to your clients once they leave as to how they can maintain and continue to keep those results.
Because that's part of it. Your home care is definitely part of it.
Absolutely.
So the home care, the Foto Facial, and the Matrix RF that we talked about in our earlier segment, complete skin rejuvenation and treatment, the best treatment for that sun damage.
So important, and especially, as you said, especially here when we get over 300 days of sunshine a year. Let's remind all our viewers where you're located so they can get all the details from you and get those great consultations. I'll tell you what, I appreciated that very much, and now I've got a lot of work to do. You can always call Bair Medical Spa at 881-1532, and you can certainly check out the website at bairmedicalspa.com. You can see a lot of great testimonials and a lot of information on the website as well. And thank you both for being here. I love when you're here.
Thank you.
And you're our first guest on the couch.
It's great. I love it.
It's wonderful.
It's nice to have you. See, so you can say you were the first ones here in our new home. We like that. Now, do you want to make some easy money? Speaking of money, we'll tell you how. Stick around. It's coming up next.